Hi, my name is Matthew Parker. Today we are going to be doing a head-to-toe assessment on our lovely patients. Before we even begin our assessment, what we're going to do is we're going to knock on the patient's door, introduce ourselves. Hi patient, my name is Matthew. I'm going to be your nurse today, and we are doing a head-to-toe assessment. And at this point, we'll be walking in the room, explaining what exactly the head-to-toe assessment is, providing privacy. As I walk up to the patients, I'll be looking at everything from color to their behavior to like their mood and effects, if they're behaving oddly, etc. And then I can also ask them their identifying questions such as, can I please get your name and date of birth? Patient tells me correctly. I'm also going to ask them some alert and oriented type questions, such as, besides your name, I'm going to ask them, do you know where you are? Do you know today's date? Do you know the season? And do you know what situation you're in or where you're at today? And so patient has correctly identified all those things, deeming them an A&O status of 4. So at this point, I'll kind of just start to begin my assessment here. I'll start by paging through their hair, looking for any lumps, bumps, discolorations, lesions, etc. Are there any patches? Is the hair brittle, etc. Kind of moving down the face, I'll be assessing our eyes, nose, mouth, and ears. And to assess our eyes, I'll get my beautiful pen light out. I'm going to assess the pupillary restriction response. I'm going to come in from the side, look for constriction, come from the other side, look at constriction, and then come from this side, but looking at this eye, making sure both are constricting. So everything looks normal, no edema, everything around the canthi looked good, everything was equal. And now I will be looking at the nares of the nose, looking for moisture, no cracked, dry skin, anything like that. And then I'll move down to the mouth, make sure there's no open lesions, sores, etc., no broken teeth, have the patient kind of move their tongue. And at this point I can address or assess the facial nerve. So I can ask them to smile, frown, close their eyes real tight, etc. Symmetry seems to be good on this patient. And then I can assess also the ears, look for any occlusion, and etc. Okay. At that point, then I would do like a full set of vital signs. So for our patient's sake, we took our vital signs on our left arm. Blood pressure was 120/80. Respirations were 15, which anything normal between 12 and 20 is fine. Took their temperature, and they were about, I'd say 98.5, so she's doing great. Let's see, also did, oh, and then of course we're monitoring oxygen saturations as well, which patient was sitting at 99% on room air. Okay, so we'll kind of move down the head and we'll palpate along the neck, looking for any jugular distension, palpating for thyroid, any masses, nodules, looking at the trachea for symmetry, etc. Okay, and then at this point we can kind of move down to our lung chest assessment, and then we can also kind of listen to our heart sounds as well. So, so I'm going to be listening to 5 different points on the chest. And everything sounded good. No murmurs or anything was detected there. Also listening to breath sounds as well. And we're listening in 6 different places. And waiting for an inhale and exhale on every time we move. Let's see, so that's good. Okay, and then at this point, then we can definitely move down to our abdomen, and we can start by just kind of giving an overall inspection, and then we'll take a listen, and we're gonna listen in 4 quadrants, starting at the lower right quadrant. And once I hear a vowel sound, I'll move to the next quadrant. Very good. And then I can just kind of lightly palpate, ask, if there's any pain, anything. At this point, I'd also ask about if we've had any bowel movements, any, loose stools, color, etc. And then, let's see. And then kind of as we're moving down here, I can also assess kind of like our musculoskeletal system, checking out range of motion of our patients. Also checking pulses on each side, making sure they're equal. So checking radial, and we could check brachial if needed. Checking carotid separately. All pulses are present. And then we can even check our femoral arteries. Moving down, we'll check our pedal and posterior tibial. Beautiful. And then at this point, I'll ask the patient to flex their feet upwards, press down like hitting the gas on our car, and those are also equal as well. And then having the patient squeeze my hands, also equal on both sides. And then we'll also check for capillary refill by pressing the fingernail beds for 1 to 2 seconds, letting go, and making sure refill is less than 2 to 3 seconds. Also doing that to the toes as well. And we passed there. And then at this point, we definitely want to check our breath sounds from the back side as well. So I'll have our patient sit up. And we're gonna be listening in 8 different quadrants or locations. Waiting for an inhale and exhale on each point. Good. And so no abnormal breath sounds were heard upon auscultation. Let's see. Points, we can assess their gaits. We can assist them to toileting at this point if need be. Ask them if there's any pain upon like urination or anything like that. Ask when their last urination was, etc. And then we can kind of move into our the kind of psychosocial aspect. Ask how their mood is. How they're feeling. Down, depressed, etc. And after that, I think our assessment should be finished. So, and at this point, take off my gloves, thank the patients, make sure they are in the safe space with the bed at the bottom, call light in place, wash my hands, and then I'd leave. So thank you.